Hi guys, sorry it's been a minute since my last video, and as you can see I'm shooting in my car, which means I'm grabbing 5 minutes in a busy life schedule, as sometimes life is, as I'm sure you are. Anyhow, posture, posture, posture. What are we trying to take from this video? Well look, posture is affected by three things, and these are negative effects, and we're trying to figure out for you, like, why am I experiencing pain? What could be going on here? Torsion, compression, as we know, and shear. We're going to talk about shear today. So shear would be, if you imagine that's a bone, and here's another bone, I'm shearing off the top of it, is an example. So these are the forces that can go through joints that we don't want to go through joints. So if we talk about posture and how that relates to it, simply put, if this was your, it could be any joint, but let's say this is your vertebrae, and let's say it's some of the spinal vertebrae columns down near the bottom. And let's say the vertebrae should be on top of each other, obviously not touching, there would be a gap, otherwise that'd be really bad. But for the purpose of this, here's two of my vertebrae, and we're going to say that that is L4, L5, for those of you who are aware of what that is. So in a normal position or an optimal position, your spine will stay one stacked on top of the other, and the muscles will do the job of postural dynamic movement. What I mean by that is, if I was to pick up an object off the floor, the force transfer of picking up the weight should transfer through the muscles, so through my arms, down my spine, through the pelvis, down both legs, and then the energy of the lift should dissipate through the floor. If I was moving an object with my hands, the object might dissipate through my body, through the object and out. Either way, the energy flows through the body evenly, and that's really important to understand. Good posture means simply that effect we're looking for happens all over the body, so we don't get forces building up in areas. However, when our posture is out, one of the things that can happen is you're lifting a weight, and because your muscles can't stabilize the joint properly, then the joint starts to get involved in the process of the muscles. I repeat that again, the joint starts to get involved, or too involved, of the joints, of the job of the muscles. So what would then happen is we're lifting an object, it's too heavy, and we start to get shear, the movement within the spine, and that causes the wear and tear. That can lead to things like osteoarthritis, etc. But if we've got, say, between L4, L5, the lower back, and we get shear going on because our posture is getting bad, and over a period of time we keep getting the shear, then what can begin to happen is, well, there's nerve endings running through those areas. So we might pinch a sciatic nerve or get issues that are going down to the lower limb because of that shear. So this is why postural elements are really important. Okay, fantastic. What can I do to improve this? Or what do I need to be aware of? Look, one of the main things to be aware of is how you're moving around day to day. I'm going to use mobile phones as the example. And this is going to, I could pick any sport, but I'm going to go for tennis on this one. So let's have a look at this for all you tennis players out there, but for multiple sports, and you'll see how this relates. Let's say you're using your mobile phone quite a lot, and you're quite often sat in this postural position, or you're at a desk and you're in this postural position, or for whatever reason you find yourself in this postural position more often than not. I say other reasons because it could be the mobile phone, it could be stress and I'm in this position constantly, it could be digestive issues and making me go into this position more often. I'm not going to get lost on that stuff. What will happen is what you're saying to your body is, you need to adapt for this position. So the muscles start doing their thing, they adapt and change, and the spinal curvature actually adapts over a period of time, so that instead of being in a neutral start position, your neutral is actually not neutral, you're slightly forward. You can see this on people as you walk down the street. Okay, so your body will adapt to it, absolutely. What's that got to do with tennis? In this position, difficult doing a car, tennis serve. Throw the ball up and go into an extension pattern, take the arm back for the racket hand. If I'm in a neutral position with good posture, I can get into the position to play the tennis serve. If my start position's here, the ball goes up, it's difficult for me to actually open my chest up to get into the position to take the racket back to play the shot. So I'm starting from a position of dysfunction. my spine can't allow me into that position. So now what I'm going to do is I'm going to hyperextend my shoulder joint, or some joint, but let's just say it's a shoulder. Hyperextend the shoulder joint to complete the action so I can actually address the ball at the apex of the toss, so that I can, or the apex of my swing, so I can play a decent serve. And I keep repeating that. So again, not to like labor the point, the spine can't move into extension, can't open up enough, so that I can't address the ball where I want to. So I have to hyperextend the shoulder through compensation to play the shot. I repeat that hundreds of times, and what I start to get is wearing away of a joint somewhere. I might get shoulder pain, might have rotator cuff issues, might have problems going on there. I then might go and see a therapist. It might be an amazing therapist who can figure this out, fantastic. Or I might go and see a therapist that unfortunately addresses just the shoulder issue, does muscle work on the shoulder, and we're actually just treating the symptom. Whereas yes, shoulder work needs to happen, but we've got to identify the cause, which was the postural element. So no matter what I do on just treating the shoulder, actually, if I don't treat the back issue, I'm never going to resolve this situation. I'll be on a treatment loop. Ironically, because my treatment will make me feel better, because the muscles get released and we get a B relaxation, oh, I feel better. A few weeks later, we might be back in the same position and go, oh, I know what I'll do. I'll go and see this amazing therapist because they make me feel better, and I can return to sport, to only then repeat the cycle. So that isn't to knock people. That's to say, look, we absolutely need to treat here, but you've got to be aware of where is a symptom and where is a cause. So going forward, what do I want you to do? Now you've got an idea of that and the shear forces, torsion, compression, but the shear forces within our body. What do we need to do? We need to adopt good postural positions. So the first thing we're going to do is going to look at our ergonomics. When we're sat in the car, are we sat back into our car so we're supporting our lumbar spine? When we're on a mobile phone, are we curved over in this position? What's our desk like? What are all our workstations like? You know, if I sit at a workstation, I'm constantly rotated to the side, I'm going to adapt to being constantly to the side. If I work at a checkout and I'm constantly checking out by going from left to right through the checkout, my body learns to go left to right through the checkout and gets a rotational pattern in one side, but I'm not rotating the other way. So I start to get a tendency to go in this direction. So you see how our ergonomics have a massive impact on our posture. So look at what it is you're doing. Look at it, how you're sitting, all those things, and how that can start to address the initial part of the posture. From there, it would be a matter of getting the correct stretches to lengthen what is short and tight, and the correct exercises, which isn't just do this PT program. This actually needs to be looked at properly to know what's going on in your body, so that you can then address the long and weak muscles to restore postural balance. Then when I serve the tennis ball, my body opens up, I transfer the weight, I hit the ball, the energy of the shot goes through my body, dissipates through the floor or into the ball, and I carry on, and my life expectancy in terms of tennis playing is significantly improved, because my risk of injury is significantly reduced. And that applies to pretty much anything you do in life, be it a sport, hobby, whatever. 8 minute 30, quick video, kind of. I'll do more on this point on the next video, and look forward to seeing you guys soon. As I said, last thing is, if you really want to get this resolved, find yourself a Czech practitioner in your area, because these guys are trained, like myself as Czech practitioner, we are trained to deal with all these causal elements to help resolve the issues that you may have posturally. Anyway, have a great rest of your day, guys. See you soon.